Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. Thank you and welcome to our clinic this evening. I hope you're having a wonderful evening. Today, we're going to look at the possibility of achieving natural pregnancy after you've had a failed IVF. So imagine a scenario where you've spent a lot of money running in millions. You followed all the instructions, you took all your injections. Unfortunately, after 14 days of your embryo transfer, you got a negative test result. It can be quite devastating. It can be very frustrating. It can be very damaging. It can be very depressing. And now you're trying to build yourself up and you're wondering if you can succeed in becoming pregnant just by yourself without going for any fertility treatment. So the big question is it possible to become pregnant all by yourself, just practicing PPP? Remember the concept of PPP. You pray, we pray a lot, then we practice. Practice means virtually everything I teach you guys on a daily basis, you put it into practice. So everything I've been teaching since 2015, you make love, you exercise, you get some good sleep. Then, of course, you play. So the biggest weapon against infertility in our group is PPP, prayer, playing, and practicing. So is it possible for you to become pregnant when you've had one failed IVF, two failed IVFs, three failed IVFs, four failed IVFs? Can you become pregnant spontaneously? That's what we're going to litigate this afternoon. And I'm here to share a good news with you. Regardless of what happened to you in your previous pregnancy, it's unique to that pregnancy. So each pregnancy build-up and outcome, it's independent of the subsequent pregnancy outcomes. Now, there are some risk factors and there are some positive factors that will help you in subsequently becoming pregnant. So the fact you have a failed IVF on itself is an isolated situation. It does not define your subsequent procedures depending on your individual situation. So the answer is yes. There are some members of our community who, for some reasons, the reason why the natural pregnancy didn't happen is because of minor adjustments, things that didn't go the way we planned it. Then ultimately, we went for IVF. For example, there are some couples that will have everything pretty much okay, but the cover of the womb, which is called the endometrium, was not thickened enough in the natural cycle. So they've tried fertility drugs, it didn't work. They've tried IUI, it didn't work. They tried IVF, it didn't work. But this particular couple, from their experience, they've started adopting some healthy lifestyle. The woman has started exercising, her hormones are balancing, she's eating properly, she's avoiding stress. Then suddenly, the hormones became better. The progesterone level normalized, the estrogen level normalized, the FSH level normalized, LH level normalized, and suddenly, the endometrium became better. So despite the fact that IVF failed, because the artificial way of preparing the endometrium also failed, but naturally, the endometrium became better. And the couples, after some time of recovery, continued practicing PPP, they became pregnant naturally. So the fact you had failed IVF does not mean you will continue to fail naturally. There are so many couples that became pregnant despite previously having failed IVFs. Matter of fact, in this community, about 20% of women that came with their testimonies are women that didn't have resources. IVF is very expensive. Now, for example, if you're in our community and you don't have the resources because you don't have, nobody can help you to raise millions to go for your IVF. You've tried fertility drugs, it's not working. You've tried IUI, it's not working. You borrowed some money. You sold some of your items and the IVF failed. For some reasons, for some people, it might take a couple of months for them to recover, because it's not just the money that we are mourning. It's the stress, it's the psychological, interest. It's the worry, it's the daily injections, it's the killjoy, it's the dashed expectations. So it's not just the millions. So some people, it can take them 3 months to recover from failed IVF. Some people, it can take them 1 month. Then there are some people that are built strong. So in this journey of becoming a mother, in this journey of becoming pregnant, there comes a point in time when you have to refuse to tap out. Because the original design for you to become a mother is the natural avenue. If everything happened accordingly the way God planned it, you don't need IVF, you don't need IUI, you don't need Clomid, you don't need all those fertility drugs. So there are times when everything must have failed, then you go back to the original design. With God on your side, you will succeed. So giving up is not an option. If you know you don't have the resources to go for advanced management, to go for advanced assessment. So advanced assessment might be giving you some fertility drugs. It might be going for IUI. It might be going for IVF. It might be going for surrogacy. It might be going for adoption. So whatever you're doing, don't lose sight of the natural ability to become pregnant. Any woman can conveniently, spontaneously become pregnant, including during your perimenopause. So long as you have availability of quality sperm, and even if you release one egg, that one egg can be fertilized. Matter of fact, if you are older than 40 and eventually you succeed in still having some eggs, the possibility that one egg can divide into 2 after fertilization is very high, so you have identical twin. Or the possibility you might have only 100 eggs, but for some time now you're releasing them in 2s. So there are some women that can release more than 1 egg and they will have availability of more than 1 sperm. Then you can have fraternal twins. So impossible is nothing when it comes to starting your family. You have to be well determined. You have to be focused. You have to show up every day. You have to be practicing PPP as if it's your religion, because that's exactly how you will overcome. So yes, you can become pregnant by yourself without doing any other thing. You can actually modify your lifestyle. Things that used to stress you, you no longer bother about them. You sleep, you drink your water, you avoid your alcohol, you avoid smoking, you eat good food. By default, your body will come back to normal. So there are so many factors that will lead to IVF failing. When we correct them, possibility that your subsequent IVF will succeed is very high. If we don't correct them, it will repeat itself. So becoming pregnant is a complex process. It's even possible that the reason why the IVF failed is because your partner's sperm was not good quality. So if after failure of your IVF and you guys go back to the drawing board and your partner began to modify his lifestyle, for example, understanding that it takes 3 months for a new sperm to be produced. So for example, if we use a suboptimal sperm sample for that IVF because you insisted that you will use your partner's sperm, but your partner's sperm is not the best, it's suboptimal within that time frame. Assuming you guys had failed IVF in June, and you took the whole of July to mourn the failed IVF, you took the whole of August, then by September, when you remember that December is coming, you're so agitated, you're so frustrated. Sometimes your frustration can push you in the right direction. But from August, your partner started hitting the gym, your partner started, drinking water, sleeping, avoiding stress. Your partner started watching his body weight. Suddenly, your partner that the BMI is in the 30s, his BMI now is in the 26. So he's modified his lifestyle. Now, towards October, November, a new fresh batch of sperm will be produced. What will happen to that sperm? Fresh, quality sperm. What will happen to the woman if they continue to make love? You become pregnant naturally. So pregnancy is still possible, despite the failure of your IVF. Pregnancy is still possible, naturally, despite the failed IUI, despite the failed fertility drugs. So whatever you're doing, make sure you don't lose sight of your PPP. Any woman can become pregnant anytime, so long as you haven't gone into menopause. It's only when you go into menopause that the possibility of becoming pregnant is lost, because when you go into menopause, you no longer have eggs. When you no longer have eggs, possibility of pregnancy is gone, because what happens in pregnancy, there will be availability of eggs, there will be availability of the sperm, then you become pregnant. So be encouraged that pregnancy is still possible, despite the fact you might have had previously failed IVF. We've seen so many testimonies. I've actually had a lady in Spain, they told her, oh, you have to do this, you have to do that. And this lady, genuinely, she didn't have money, but she belongs to this category of women that pray a lot, but they make love only twice in a month. The time she feels she's ovulating. I told her, you know what? It's really going to be tough for you to travel to Nigeria and all that. I'm going to give you one prescription. Instead of waiting for 2 times to make love in a month, start making love every day. You see, sometimes the hard way is the only way. The lady felt bad. I said, this is my prescription. I've checked your result. Everything is good. Go home, make love for me every single day. Within 2 months, she came back positive. So long as God is still God, and you have availability of even 1 egg, that 1 egg is able to multiply into 2. So some women can actually come to the end of their whole reproductive cycle. Unfortunately, when you get to 35, you will notice a sharp decline. By the time you're getting to 37, if you plot the map, you will see a sharp drop in your fertility. The quantity of the egg is reduced, the quality of the egg is reduced. So it's that time you have to task yourself. Coincidentally, it's as you get older that your interest in lovemaking is reduced, because as you're getting older, the level of your estrogen is coming down, your FSH is going up, so it makes you dry, it reduces your libido, so you have a complex problem. You have a problem of not having a baby, then you have a problem of not having interest in lovemaking. Meanwhile, you're supposed to make love every other day. So it's a complex process. So what I'm encouraging you to do today, as you're getting ready to end your November, never lose sight of your PPP. When you wake up every day, thank God for giving you life. Life is most important. You have to be around to have a baby. You have to be sane to have a baby. There are so many women that have lapsed into depression. There are so many women that have anxiety problems. There are so many women that have stress disorders. What will happen if you have depression, anxiety, and stress disorders? Your libido will be ground zero. What will happen when you have ground zero libido? You cannot make love. You cannot go for fertility treatment. So what will happen? You are sinking. So if every other thing fails in your quest to become pregnant in 2023, embrace your PPP. It works. Pregnancy after failed IVF is possible. Pregnancy after failed IUI is possible. Pregnancy after failed Clomid challenge is possible. This is the original design of how God wanted you to be a mother. And it's going to be the same until you become. Thank you so much. That's my presentation. I'm going to open the clinic now. And I encourage you to ask me questions. So I can see my colleague, Ogechi, a fellow mentor in Afromedic. Thank you so much. Please, when you have a moment, feel free and ask me questions. I can also see COO. Thank you so much. So it's time for questions. We have about 7 minutes to ask questions. So hit me up, ask me questions, and I'll provide you feedback. Now, if any medical student is also in the clinic, feel free and identify yourself, ask your questions. Let's make it interactive, okay? So the clinic is open now. All right, true, correct. Dr. Ogechi, failed IVF doesn't mean failed natural ability to become pregnant. You can still conceive naturally, even in your 50s. The tiebreaker is regular lovemaking. So consider your lovemaking like the parable of the 10 virgins. The body of a woman is so tricky that sometimes there are certain things you will think you understand, you know nothing. There are some women that prefer to release their egg by 1 a.m. in the morning. Let's do some mathematics. An average Nigerian guy will be snoring by 1 a.m. An average hustling, working Nigerian man might be in traffic for 12 hours, 10 hours. So let's do some permutations. You guys probably don't fancy lovemaking in the morning, right? You believe that is in the night. So the guy normally leaves by 6 a.m., comes back by probably 9 p.m. And what will most men do by the time they come back from a very stressful day? They just want you to give them their food and they will sleep. So what will happen? When you release your egg by 1 a.m., you have only 24 hours window. So if you don't have the practice of regular PPP, what's going to happen? You have released your egg by 1 a.m. By 1 p.m., you've spent 6 hours. By the time you're circling back to the following day, which is another 1 a.m., if your partner did not deposit fresh sperm in the vagina, which will still be valid for 5 days, pregnancy chance will be gone. So for the month of November, you only have one 24-hour window to become pregnant in November. Once you miss that window, you wait again in December. So it's important you understand this. So when we encourage you to make copious lovemaking, you are increasing your chance of pregnancy per lovemaking, per ejaculation, by default. Very important. Hope Ogochukwu. Okay, so I don't have any other questions, but you have 4 minutes. So if you have any questions, even if it's outside this particular topic, feel free and ask your question. Now, I want to announce to you what we have planned for this month. If you have always wanted to have a baby girl, if you've always wanted to have a baby boy, and it's causing a lot of problems in your family, you see, boys and girls are the same. There is absolutely no difference. Matter of fact, if you ask me, from my experience as a maternal and child health specialist, if we are actually to give a credit, if we are to pass a judgment, if we are to take sides regarding a baby boy and a baby girl, baby girls are more valuable regarding whatever you want to have in life. There are some baby boys that will turn out to be men that will even surpass the women. But most women are more prone to doing pretty much everything and sticking with their parents till life. So the concept of thinking that, oh, baby boys are more superior to girls, that's when you will not be on the same page with me. So if the reason why you want to have your baby boy, a baby girl, is because you want to have them, because growing up you have a sister, you have a brother, there is nothing wrong in wanting to have a baby boy. There is nothing wrong in wanting to have a baby girl. But is the reason why you want it to have it, I query. So if you have girls, love your girls. If you have boys, love your girls. But if you have the capacity to add more to your family and you want a particular gender, why not? It's okay. But do you know the right ways? So on the 26th, we are gonna host a super masterclass to teach you the fundamentals of reliable gender selection. It's possible. So if you have not registered for that event, quickly go and register and make sure you come with your partner on the 26th. Okay? Stella Dan, that sounds like a medical student's name, okay? Is natural pregnancy after failed IVF a high-risk pregnancy? It depends on some parameters. For example, once you've crossed the Rubicon, which is 35 years, you are naturally classified as a high-risk pregnant woman. So any woman that wants to become pregnant from age 35 and above, we are going to look after you as a very precious lady because you're carrying a precious baby. Your risk factor will improve. So age is a big player. So it depends on the likely reason why you had that infertility. So if you're older, you're prone to having miscarriages, gestational diabetes, chromosomal abnormalities. So definitely your risk factor will increase. But if you don't have any other risk factors, the natural pregnancy will just assume its own role. So it's independent, it's unique to that individual. So if you have other concomitant risk factors and you eventually become pregnant, you're still going to be exposed to those risk factors. So it depends on your medical history. It depends on your family and social history. It depends on your lifestyle. So there are a couple of lifestyles you might be adopting and you might be putting your baby in danger. So it's a totality of you have to look at when you want to become pregnant. I love that question. Okay, so what are the precautions you need to take? Of course, you know when you become pregnant and you have risk factors, one of the things you have to do is to register for early ANC. You go for your antenatal visit, we check you and your baby, you take your prenatal multivitamins, you avoid, all those abnormal lifestyle, you be very alert You do your own part, then God will do his own part. That's all you need to do, okay? All right. Is natural pregnancy, okay, I've already answered that. Do we have any other question? Any other question? I have just one more minute before I go. So I haven't heard from Soprano Doctor. I haven't heard from COO. That's very unusual. I hope YouTube is not hiding some questions, but those are the questions I have. Now, after this particular clinic, I'm going to run another clinic in Facebook. So if you're in our Facebook group, join me there. I'm going to spend another 20 minutes. Then we're going to go get some break. Tomorrow is another opportunity. We'll find another topic. We continue the conversation. My YouTube is every Saturday, 3:30 p.m. Then every Tuesdays, 6:30 p.m. Nigerian time. Sorry, 6:30 p.m. US time, Eastern time. So this is 3:30 p.m., which I believe should be your 9:30 p.m. in Nigeria. But if today is the first day of attending my event, I appreciate you. Before you leave, please click on the notification so it will tell you when I come live. But expect me on Tuesdays, 6:30 p.m. Eastern time US. Then on Saturdays, 3:30 p.m. Eastern time US, which is 9:30 p.m. Nigerian time. At what point is adoption discussed as an option? Everything must be on the table the moment you are classified as having infertility. Remember the original definition of infertility: inability to become pregnant despite regular unprotected lovemaking for a period of 12 months if you're below 35, for a period of 6 months if you're above 35. So the moment you're coming to the table of fertility treatment management, you should come to the table of equity with justice. You should not remove anything on the table. So fertility management is a stepwise process. Initially, we come in, we encourage you to go through the natural process. If the natural one fails, then we start you on fertility drugs. If fertility drug fails, then we begin to look outside the box. We'll probably graduate to IUI. If IUI fails, we go to IVF. If IVF fails, then we begin to think about surrogacy. Now, if surrogacy fails, then the last option is adoption. But this is what I will tell you. If you know fully well you're 50 and you genuinely want to be a mother, personally, think about having a branded family. A branded family. So what I mean by branded family, you can still be trying naturally at age 50. You can still be priming yourself to go for IVF with donor eggs. You can still be looking for agencies you can go for adoption, and you can still be going for surrogacy. So have a blended family. Whichever one that works, go that route. Don't have a one-way traffic approach. There are some women, the reason why they don't have a baby right today is because they believe they can do this naturally. But there's a reason why God made it possible for some people to be out there to help you. So if you start working naturally, seek help. And when you go seeking help, the earlier you get this help, the better. There are some families that would have had grandkids today, but they condemned IVF. When IVF came into picture, they condemned it. There are some families that believe so much in their religion, forgetting that your religion is supposed to give you something good and make you better. There are some people that believe, oh, because I'm this particular denomination, we don't do this, we do this, we do that, and all that. But you're denying yourself what's going to make you happy. There are some people that don't believe in IVF. There are some people that don't believe in IUI. There are some people that believe that if it's not happening naturally, then they're going to go to heaven alone. You can still be a good person, but you don't have a baby. But if you know that having a baby is going to make your life better, there are so many ways you can become a mother. Any woman can be a mother. Unfortunately, not all women will become mothers through pregnancy. Some women can still become mothers through other means, but only women that are still within their reproductive phase of life will have their babies through pregnancy. But a mother is a mother, whether it's natural, whether it's drug related, whether it's IUI, whether it's IVF, whether it's surrogacy, whether it's adoption. A mother is a mother. A baby is a baby. Don't waste the time you don't have. Understand that as a woman, you are programmed. You are a precious commodity. So God will introduce you in this world for a particular time. When you lose that time, you will lose that opportunity. When you compare yourself to men, you will see that you are a customized, scarce commodity. So you need to be wise. Thank you so much for coming. Any form of bleeding in pregnancy, which is confirmed not to be implantation bleeding, is abnormal. Once you are pregnant, The hormones that ordinarily will lead to normal bleeding will cease. The reason why you're bleeding in your normal cycle is failure of pregnancy. So once pregnancy happens, you will stop bleeding. So anytime you notice any spotting or bleeding in pregnancy, there's a problem. Report to your doctor, let's investigate. So there is nothing like normal bleeding when you're pregnant. So women will come and say, but my sister told me throughout my pregnancy I was bleeding. It's called abnormal bleeding in pregnancy. It means that pregnancy is challenged. We need to figure out what to do differently to see if we can save the pregnancy. Okay? All right. Okay, so I believe that's the only question I have. And I can see a lot of traffic from medical students. So thank you so much. If you're in Facebook, hop into Facebook. Let's continue the conversation. Until I see you guys, thank you for coming. God bless you and bye-bye.